All right, you are live. All right, I'm excited about this topic because it's probably one of the. I'll kind of drag a little bit so I can let some people come in. Want to do this because it's like one of those videos that like isn't like super popular because I don't think people are really searching in a sense of like on Google for it because it's kind of more of like a personal question that you would ask like your physiotherapist, your doctor, your surgeon kind of thing. But it's a common question. It's a question that gets asked all the time, and it has to do with exercising in pain, right? So you whether you deal with acute pain, whether you deal with chronic pain, this video topic is going to be talking about how to progress with pain. If you're in the gym, you're working out, and if you're in a chronic situation, if you're in an acute situation and you're experiencing pain, how do you progress? How do you move forward? Should you stop? Should you kind of say, I'm going to take it easy. I'm going to wait until I'm pain free. And what's cool about this is the answers to this question, and we ask it a lot of different ways, but the answer ultimate to the question is actually backed by science. Like there's actually studies out there. And if you want to know what the studies are, you can let me know in the description of this video, and I can pull them up and link them to the description. And you can read those for yourself. But it's backed by science. It's basically what current research is saying about if someone is having pain and they're trying to work out, should they wait until they're pain-free and then progress? Or is it okay to work out despite having some kind of pain in my low back? Or really this kind of applies to the entire body, but I talk about low backs. It applies to low backs. So that's where we're going to go with it. So I want to start with an analogy, which I heard this the other day, and it was absolutely awesome. And I'm going to give you the analogy and how amazingly it connects with approaching exercise and chronic low back pain. So this is the analogy, and I'll give you the answer and how it applies to it later. But if you were stuck in a dark room, if you were put in a dark room by yourself with a chair and a door, you have no idea how big the door is or the room is, you can't see anything, your eyes are not going to adjust, pitch black, no light. How would you get out? How would you get out of that dark room? There's a door there, it's unlocked, you're free to go, you're not chained up, you're sitting in a chair, pitch black room, can't see anything, you've got to get out. So how do you get out? And I'm going to leave that there on the table for a minute, and then we'll recircle back and answer that question here in a little bit. I don't want this video to be long. It's not a long topic. I don't want to drag it on. So we'll kind of jump right into it. So when we are talking about chronic back pain, let's talk about chronic first, then we'll throw acute in there because they're not the same, but in the response to this question, you can approach them the same. The answer is the same for both people. And the question again comes out in, I'm experiencing back pain. Should I keep going, or is it better to pull back and be safe and wait? According to research, this is current research, people, they took two groups of people. One group of people who they had acute pain and they put into exercise, right? One group had to only exercise if they were pain-free. So that means they went into the gym, they went into their clinic, wherever the situation setting was. They were only able to continue to exercise if they were pain-free. They got results from that test. Then they took people who, the acute pain people, and they put them in a gym and said, you can work out and you're allowed to progress. You're allowed to push into pain with a 4 out of 10 level. So if you are in, for example, if you're in my Smart Strength membership, if you're not, I can put a link below, talk about that later. But if you're in my Smart Strength membership, I grade exertion, or I grade the intensity of exercise based off of your perceived exertion. All right, it's called RPE in the fitness space. And what it does is you scale or you grade yourself based off of a number. So if it's a really hard workout, you're like 10 out of 10. Your RPE is 10 out of 10. If it's really easy, it's like 2, maybe 1 out of 10. So that's the RPE scale. So this acute pain group, we're saying, okay, your RPE 4 out of 10, right? If you can work out with a little bit of discomfort, a little bit of pain, but if you get to that 4 out of 10 pain level, we want you to stop. Okay, so both groups, acute, went into this study and they had the 4 to 10 pain level as their parameters, and they had their pain-free as parameters. Guess who saw the results? Guess who saw results? Guess who they were able to work on long-term relief, able to get to the point where they were building strength despite their results, despite what class they were in or camp they were in. Guess who saw the best results? Remember, camp one, no pain, progressing with no pain. Camp two, progressing with minimal pain, 4 out of 10 pain. Both camps had the same results. What does that tell us? I'm not going to get into that quite yet. Then you have the chronic pain. Now, this is my space. This is where I love to be, because chronic pain, it sucks. It sucks. It sucks. It sucks. And I know exactly what it's like. I've been there. And this is where I kind of put myself in this industry, helping you guys. So chronic pain, same situation, going pain-free. Now, when you're in chronic pain, technically, if you're dealing with chronic pain, you're not really going to have a pain-free day. Now, I think on the contrary to that is, yes, you can. I think someone who lives with chronic pain will have pain-free days. That's just the nature of the beast. You have bad days, really bad days, bad weeks, bad months, great weeks, great months. That's the chronicness and the circle of a pain cycle. So with that being said, let's look at the chronic pain situation. Same situation. Can you progress pain-free? We're going to wait until your chronic pain is at a day, time, week, month, year that you are pain-free, and then we'll enter you into exercise. And then you have the level of people who are, say, you have some underlying chronicness to your pain. So let's put you into exercise and then see how it goes. Guess who had the best results? Chronic pain, exercise, pain-free, or up to a 4 RPE, minimal pain, minimal discomfort, but the pain and discomfort was there. Both had the same results. Everyone progressed the same, whether you pulled back and waited until you were pain-free, or you were like, hey, you know what? I'm going to push the envelope a little bit and get to that 4, that 5 RPE, that 4 or 5 out of 10 pain scale. And when I get to there, I'll back off. Both groups had the same results, which is awesome, which is amazing for you, because when it comes to chronic pain, when it comes to exercise, fear is one of the biggest factors when it comes to people progressing or not progressing. We are afraid to make the mistake. We are afraid to cause more pain. We're afraid to cause more damage. So what happens is our lack of knowledge, right? Because it's not your responsibility to know everything about exercise and pain. That's not you. You're an engineer. You're a teacher. You're a stay-at-home mom. Like, you're a stay-at-home dad. Whatever you may do, that's not your job. So who cares? So you want to find a coach or find a physician or provider who understands this stuff. And this is why current research is so important. Whether you're seeing a physiotherapist, a chiropractor, a PT, whoever you're seeing, they got to be up on the research. Real quick, if you have any questions, put it in the comment section on the side. I'm gonna try to get to those at the end of the thing, and we'll kind of chat it up. We'll shoot the breeze in there, but I'm gonna keep rolling with this. So the results were the same, which is awesome, because what that does is answers a question. There's something floating by me. It answers a question. Oh no, I'm experiencing pain. Should I wait till I'm pain-free, or is it okay to kind of push into pain, push into discomfort, and still exercise with boundaries? Yes. And this is what's awesome, because when it comes to pain, fear, worry, anxiety around your post-surgery fusion, herniated disc, laminectomy, discectomy, whatever you may have had, and you have a history of chronic back pain, you have acute pain, or you have a history of spinal surgery, you have the freedom to do what you feel comfortable doing, which is why the people who I work with see so much success, because I give them the space and the grace in their own journey to understand that and get to the point where, like, okay, like, I am super fearful of exercise. I'm super fearful of pain. I believe in my mind that I should be 100% pain-free, which you don't want to be that. But if I was to be 100% pain-free, I'd rather progress with that. Well, if that is you, that's fine. You're going to see results, but you're going to be starting and stopping, starting and stopping, starting and stopping. And if that's what gets you progressively down the road to exercising, confidently building strength and overcoming the chronicness of your pain, do it. That's awesome. And if you are the type that's like, you know what, bump this. Like, I don't want to wait till I'm pain-free, because that I could wake up for a bad night's sleep and be achy and be sore and be tight or tense or whatever. So that I can, in my mind, I can see that being super frustrating because it's like you're limiting your window of exercise to only the pain-free days. But we have to respect the people who are in that camp who want to be as careful and as cautious as possible. Then you have the camp where like, I'm ready to get to work. I'm ready to start exercising. Those people have the freedom to start doing it. Right? Now, this is where the boundaries come in because you got to have boundaries. There's good and bad pain when it comes to exercise, right? There's pain induced by exercise, doing the wrong type of exercise, doing the exercises in your mind that are scary. Let's just say squats or deadlifts or whatever you dub as scary. It could be a lot of different things. Simply being on your back on a hard floor, if you've been fused, could be scary to you. So you have to understand that where you are at, in a sense of what you can and cannot do. If you're dealing with herniated discs, bulging discs, ruptured discs, post surgery, whatever, there's common sense limitations. And if you don't know what those are, I suggest that you figure those out, find those out, ask questions, or you get into a workout program that is designed for chronic back pain people or post surgery people. So understanding your boundaries and knowing what good and bad pain is, but regardless, as you learn to navigate what good and bad pain is, the best boundary, according to research and science, is that 4 or 5 out of 10 pain scale, which means that what's safe is if you can exercise and you get to the point where you're like, okay, I'm kind of feeling some discomfort, but I would score it around 4 out of 5 or 4 or 5 out of 10 on the RPE scale, or the how painful or how much exertion you think you're putting out, right? If you can score your pain at that level, then you're safe. You're getting into the 7, 8, 9, 10 out of 10. No, there's a lot of things going on. Your nervous system is going crazy. It's just throwing pain signals down your body. You don't want to go that far. You don't want to have to deal with that kind of stuff. So know those boundaries, right? Know those boundaries. Now, make sure I have my rule of thumb, and this is kind of what a lot of people will ask as well, is like how the post exercise situation, right? You worked out 24 hours later. That's a good window because sometimes when you're in the gym working out, you're experiencing like endorphins, right? So your pain almost kind of goes away. So what happens 24 hours later, right? What should I do? How should I grade my pain and how my exercise affected that? There's 3 ways. There's it caused more pain, it's neutral, or I have less pain. It seems kind of common sense, but this is a good rule of thumb to follow, right? If you did a workout and exercise, whatever, and it caused more pain, right? You're doing this routine, this strategy, and your pain is getting worse doing that exercise. Let's pull the exercise back. You don't want to do it. You're going too hard. You're doing too much. It's just not a good exercise for you to be doing due to your situation. That could be due to fear. It could be due to just your body's protection mechanism doing anything. I remember just picking things up off the ground for me. That would trigger tension. I would pick up 5 or 10 things off of my garage floor, and then I'd just be dealing with tension, my lower back, because I was always afraid to bend over, right? So that triggered pain. So if it causes more pain, we have to address the exercise, address the workout. You've got to be training smart. You can't be doing exercises that are playing into those fears, at least not at first. Dial them back, get into a safe position, and then approach the same exercises progressively with a smart approach to it. Then neutral. If you went into the exercise with a 4 out of 5 pain scale and you come out 12, 24, 48 hours later and the pain's just there, it's still there, it didn't help it, it didn't magically take it away, but it's just neutral. That's a good place to be. That means you train the body, you challenge the body, you challenge the nervous system and all the fears and anxiety you have around exercise and movement and strength training and your pain. And the result of that was neutral, which means continue to progress, right? Because exercise is not like, I always say this, exercise is not like taking a Tylenol for a headache, right? Exercise for back pain is not like taking a Tylenol for headache. Medication will always be faster. It'll always give you the quick win that we all want. But the long game is addiction. The long game is Band-Aids and surgery and all those things that the medication was covering up. Now, if you had surgery, you're totally fine. You still have so much room to grow. So you're not like, oh, it's too late for me. That's not true at all. So let me know in the comment section, like, have you had surgery before? And if not, if you have had surgery, put the comment in there what surgery that you had on your spine. If you have not had surgery, what were you diagnosed with, right? What were you diagnosed with? Put that in the comment section. Then the third point is if it took away pain or took away discomfort, right? That's the fun one. That's the awesome one. When you wake up 24 hours later and you're like, wow, I can do all kinds of stuff now. Like those deadlifts or those lunges or those glute exercises, or that core training really helped. It healed me magically. And for some people, that's how it works. Sometimes people just read a book and they learn something about pain science and their pain goes away. Some people, it takes time. They have to process the information. They reread it over and over and over. Or the same approach to exercise. They have to continue to do it to get the same results. Everybody's a little bit different. That's why the power in long-term freedom is consistency and trusting the process and following a smart program that fits back pain specific, right? Back pain, that's critical, because if you're following one that is back pain specific, all the nuances, all the coaching, all the verbiage is based around experience with back pain. And there's so many nuances to back pain and actually suffering with chronic back pain for so long that a lot of people just don't understand it. They don't get it, because if you're a clinician and you've never had back pain before, all you know is textbook and maybe your experience of working with people. You have never experienced pain for yourself. Totally, it's a big difference. So those are the three things. It made your pain worse. Stop, pull back, adjust. It's neutral. Keep going. It's safe. Continue on. Maybe push the envelope a little bit or stay there for a week or so and then push the envelope, see what happens. And it made your pain better. It took it away for a little bit. Then you're doing good. Keep going down that road. Okay. I think so. Let's finish up with the analogy. You're stuck in a dark room. If you were there to the beginning, the analogy, go back, rewind, go back to the beginning. The analogy, you're stuck in a dark room. There's you, a chair, no change. You're not chained up, and there's a door. And they're like, "Sir, you can try to get out now." And you're free to go. You can't see a thing. What do? I'll tell you what you don't do. You don't jump up from your chair and just start sprinting to the wall, or you can't even see the wall. You don't just jump up and start sprinting. No, you don't do that. What do? You say, okay, well, what the heck? Where am I? Why does it smell like cheese in here? Cheese and rats. Why does it smell like that? And once you get over that, you say, okay, like let's just stand up first, right? Let's take a small step forward. Okay, like there's no wall. I'll walk a little bit faster. Okay, there's a wall. Here's the wall. I'm safe on the wall. My hands are on the wall. Now I'm gonna go right or left to find the door. So you might go a little bit faster. You might pull back and turn around because there's an obstacle. But you get up and you make slow movements to find that door. This is why that analogy was like, it just hit me so well when it comes to navigating chronic pain and beating and overcoming back pain and using exercise, movement, and mindset to overcome these things. Because when you do it, when you go into the gym or when you start a new program and you're like, okay, this program's for back pain, or I just want to start exercising with back pain, you don't just go 0 to 60, right? You don't just start sprinting through your program and trying to do all the things and trying to progress faster, because if I progress faster or if I consume all the content super fast, then I'll get better faster. Like, that's not it. It's not a sprint. You'll hurt yourself. Just like if you jumped up from the chair and you sprint as fast as you can, you'll slam into a wall and it'll hurt, right? So the same thing goes to navigating chronic pain. It's never a sprint. You don't just get up and just go because you found a YouTube video on yoga stretches for back pain. They're garbage, okay? That's not what you do. That's a shotgun approach, and it's one of the worst approaches that you could ever do. So I hope that analogy helped you. I know it helped me. So I'm gonna jump into comments really quick. I appreciate everyone being here. This is awesome. I know the replays on this, because everyone's at work and doing crazy stuff, so the replay is gonna be just as good as well. I have a long back stress issue. I practice yoga regularly, but issue is not solved. So I have a YouTube video on here, Gurmeet or Jermeet. I hope I don't mess that up. I'm sorry. I have a passionate placement for yoga in my heart. It's about this big. Yoga fits in my heart about this big, right? I don't like stretching to the point of now there's a lot of the mindset around yoga is great, right? And there's aspects to yoga that's powerful. And I am sure there's someone in this world who could say yoga healed me of all my pain. So there's always outliers. But in my experience, both personally and with clients who stretch and practice stretching, yoga, whatever you want to call it, to relieve back pain, it never works out in their favor. It's always hit or miss. It's always, I felt great after, but then 24 hours later, I just feel beat. Or they have to continue to stretch every day, stretch, just to keep the feeling up. So if you are a stretcher, leave a comment below. Say, yes, I'm a stretcher. What should I do? If you stretch a lot and you can't resolve your issue, I highly suggest you just stop stretching. Just stop stretching altogether. I know you feel tight. I know you feel tense. I know you have taught your nervous system to crave that freedom and that feeling of that Golgi tendon reflex, which is a little bit of science for you. I'm not gonna get too crazy with that, but to get that quick relief that you get from stretching is short term, and it'll always only be short term. Now, if you're trying to learn how to do the splits and you can't do the splits, guess what you're going to have to do to learn to do the splits? You're going to have to stretch your groin, stretch your inner thighs, hamstrings, quads, all that. So stretching has a purpose. Stretching can be powerful, but in the context of chronic pain, stretching does not work, right? And if you go to you can watch a YouTube video where I say why I think I talk about it's literally labeled why I stopped stretching or something like that. So check that out. I can't link it right now, so I apologize for that. But I would focus more on strength training, exercising, finding a program that fits you, that is safe for people who have a persistent back issue, who've had surgery. I will tell you that I have a membership called the Smart Strength Membership. I design and I have a whole coaching portal in there for exercising for those who have chronic back pain or history of back pain or history of surgery. I'll link it in the description below. And it's a membership where you have access to my training programs. I write programs every month and I put them in this system. You can get on your phone, your tablet, your computer, whatever, and you follow along. It's video based. It's not PDFs and you shuffle through pages. It's not like that. So Smart Strength Membership, you can go to fitnessforbackpain.com/smart strength if you want to check that out. That is 100% exercise, full workouts, 45 minutes or less workouts, strength training workouts that will build strength, build confidence, and get over the fear of exercise due to your pain. And we'll also see some progression, especially if you're going to give up stretching. Nick, never had a worse acute pain than my lumbar injury. Sorry to hear that, bro. What's popping? Boundaries suck. They do suck. But if you respect boundaries, you'll see results. Because again, like you got to think of it like this, right? Here's your boundary. And here's you exercising. This is your pain. This is your threshold of exercise. So you exercise, boop, 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 and you hit that boundary, right? Or you exceed the boundary because you're a no pain, no gain kind of guy. Nick likes to push it because I see you look jacked. You look jacked. But so here's your thumbnail. Here is your pain threshold. You start exercising and you exceed that boundary. So you're constantly hitting that inflammation spot. Boom, boom, boom. Every time you work out, you're like, no pain, no gain. Gotta go. And you always push the envelope. Well, this is what's called your pain cycle. This is what triggers pain and flare-ups over and over and over and over and over and over and over. Right? And how long your flare-up lasts depends on your nervous system. And that's not on you. It's not necessarily on what you did in the gym. It's solely based off of your brain and your nervous system and how sensitive it is now. So what you want to do, your boundary, exercising to here and back, exercising to here and back. And what you do is you find that fine line of getting closer to that boundary with your exercise and workouts, right? Until that boundary or that pain threshold gets so desensitized that it goes higher and higher. And now you're lasting 45 minutes in a full workout doing things like squats, deadlifts, bent over rows, pull ups. You're doing things that cause pain because those exercises once hit the boundary that's way down here, right? This might be 20 minutes of exercise. This is now 35, 40 minutes of exercise. Now you're over an hour of exercise free that you can do that. So boundaries do suck, but boundaries are powerful. And if you follow the right training program that keeps you under those boundaries, you're on track. Acute traumatic lumbar disc injury. 24 hours later, I couldn't get out of bed. That's a big deal, man. I've had spasms. I remember in college, I did deadlifts, and this is before I knew that I had ruptured my disc. I may have ruptured that day. Who knows? But I literally, like, I couldn't use the bathroom standing. Like, I would put my head forward, and the whole back of my body would seize. Like, I had to like look up and bend down. It was nuts. It was absolutely crazy. So I definitely know traumatic acute situations. I've been there. Julian, what's up, bud? I always feel great during exercise. That's awesome. 6 months in, and I'm 38, feeling like 70. No bueno. I know that feeling, dude. I was diagnosed with my ruptured disc, I think at age 22, and I'm 33 now. 22, I was told that I had ruptured my disc and I had degenerative discs above that site, that I would never be able to deadlift, squat, do the training that I was doing at the time. And it sucked. I had a kid a couple years later. I had a second kid years later, 3 years later, and I dealt with all that acute and chronic back pain, and it was terrible. Like, I mean, I'm 27, 26 years old with a kid, and I'm trying to do stuff that normal 27-year-old dads do, and I couldn't because of the pain. So I know what you're saying, man. And you can do stuff. Like, you got to get involved, and that's a big thing. Is I want to do lives. I want to do content. I do content every single week for you guys to consume for free. But always keep in mind, if you're listening and watching this now or later, it's only a piece of the puzzle, right? It's impossible for me to say, okay, we're going to sit down and I'm going to give you everything I know, because we got to tailor it to you, and we could be here for hours, right? So just understand that content is only pieces of the puzzle that you have to navigate and put together. There's options out there. There's courses out there that give you everything as that you can just navigate, that you can walk through and adjust, but you're on the right path. And that's the best thing to do. Unless you know what you're doing, then keep going after it. Be consistent, keep challenging your progression. You'll get there. But if you don't, I highly suggest you find and get involved with a place like here that can give you more structured advice and rules to follow. So I'm 35, Nick. Welcome to the club. 2 years in. No snap. No surgery. Acute traumatic disc injury from acute active person to an old man. You'll get that. Nick, you're going to get there. You're going to get there. Oh, the wifey logged in. Hey. Surgery, no surgery. I honestly, like, I'm not partial to post-surgery or no surgery. Like, no, that wasn't Corona, okay? That was not Corona. That's just a little cough. I've been talking for the past 30 minutes. But I'm not partial to acute or chronic pain, or I'm sorry, non-surgical pain and post-surgery pain. I'm not acute to either one of those, right? I take them on in a sense of, I look at them pretty much the same way. I like saying that, oh, you haven't been diagnosed with anything, or your doctors can't figure out what's wrong with you, but you have sciatic symptoms, or you've had just chronic tension, but they can't find out what's wrong. That's fun. That's great news, because odds are it's nothing. It's nothing. And it's wrapped up in just the way you look at your pain, your past experience, your history. And then the people who have surgery, it's easy for them to hang their hat on, oh, I had that surgery. They cut and fused 4 discs. That's a big deal. And that is a big deal. So, but you work on navigating and changing and reframing your thought pattern and fear around that surgery, right? So both of them approach back pain exercise and getting out of pain in essentially the same way, but the verbiage just changes because non-surgical, you've never had a reason to say, yep, I've been cut open. I had pain because of that. You're just like, they can't figure it out, right? Or they don't know, or they say I have herniations or bulges or ruptures and all that stuff. So there's hope. There's absolute hope no matter what. Okay. Maria, I was diagnosed with scoliosis at 13 years old, had surgery at 24. What's cool about scoliosis is I don't have a lot of experience like taking someone from like having scoliosis to like not having scoliosis. It's not my place. I know the basis of it, and it all comes down to strength training. It all comes back down to strength training, but doing it very strategically. And a lot of it is movement, corrective exercises. So Maria, there is hope for people who have scoliosis. And I will suggest there's a group called functional patterns. Functional patterns. They are a off the wall type of approach to exercise and correcting things. But I know that if you have scoliosis, they've done great with people like that. So they use exercise, they use strength training. But I know that if you find them on YouTube, I think you can look up like scoliosis, functional pattern scoliosis, and they might have some testimonials. But that's a great group of people to even just talk to about specifics if you want to get into specifics. And that's just depending on how severe your scoliosis is. You said you've had surgery, I'm assuming, to correct it. So do you still have it now? Is it pretty much corrected from the surgery in a sense of obviously there's still some things in your back? You might have hardware still, maybe not. But they deal with severe scoliosis. Like it's really severe. So it's always something to look into. Lack of flexibility, little back stress, unrest to go away. Flexibility. Lack of flexibility is definitely that can be due to tension, tightness that you're experiencing. It could also be just from your body's protection mechanism, right? It's just like it's freaking out, and due to pain, due to a history of pain, it's just like, whoa, we have to like protect ourselves. If we don't, he's gonna snap something, like because he's gonna try to pick up his dog again, or his pencil, or the toilet paper off the floor because you're too lazy to put it on the little spinny thing. You go to grab it, and then boom, So years and years and years of that, like years and years and years of me, I'd suffered for back pain, chronic pain for over 6+ years. During those times, I limited my movements. Like there was no twisting. There was no like excessive bending. So there's tension. Like I have natural lack of flexibility due to me being afraid to challenge those movements. So now what am I doing? I'm challenging those movements. And I'm getting my flexibility back. So just because the muscle, we have to be careful that we're not stretching how can I say this? There's a sensation of tightness, and then there's actual muscle tightness. Two different things. The sensation of tightness leads to chronic pain if you consistently keep trying to stretch through the sensation that you feel tight. Then there's actually shortened muscles that need to be stretched, and they are like 100%, okay, yes, this needs to be stretched. Okay, so that's where a lot of people go wrong. No surgery, disc bulge at L3, L5, impinging my L4 nerve root on my left, radiating pain to left knee. Helps, cannot do any jumping or running. That's totally fine. There's nothing wrong with not being able to do jumping or running. Okay, so it's as long as you're doing the right exercise, you're exercising smart, you can get back to that stuff. Again, it's all about desensitizing where you are. Touching my toes relieves my pain. I do it whenever the pain becomes unbearable. And Connie, what that's doing is you're cashing in on your body's natural stretch reflex. Okay. When I was at my worst and I would be in pain, keeled over in pain, just like it was just terrible. I was so desperate that I would jump on an inversion table. I would hang from an inversion table and try to twist and stretch and just get relief because I felt like my back was just like locking in. So I definitely understand where you're coming from, but I will tell you that if you are doing that stretching and it's not giving you long-term relief, like it's not progressively getting better by doing it, I would suggest you not do that and you approach it a different way, right? There's a fear factor, there's a movement factor, and there's a strength factor. Fear comes around your history, your pain history. what you've been through, your sensitivity, your nervous system. Then there's strength and there's movement. How the quality of your movement, how you move, and then there's strength. Are you building overall strength back in your body, which is going to help with that fear, which is going to help improving movements and being more confident in your moving, right? So once you combine all these three together, the fear, anxiety, worry, panic, pain science, understanding pain, moving better, and building strength, when you combine those three together, guess what your body does? Guess what your nervous system does? It starts to relax. It starts becoming more confident. It starts saying like, dude, like she's getting better. She's stronger. She's more confident. She's trusting things again. We can chill out. We can turn the alarm system down. Your pain signals are an alarm system. It's your body's response to internal things that you sometimes can't control because your brain runs everything. Those three things are extremely, extremely powerful. And I talk about them here or there all over my website, on YouTube. If you want a little bit more of a structured approach, you can check out Relief Academy, which is fitness for back pain, www.fitnessforbackpain.com/relief academy. That goes in depth and approaches all three of those things with the end goal of beating chronic back pain. That is what it does. So if that is what you want to navigate, I'll put a description. I could type it in here. I got to add both of those. Fitness. Almost done with these questions, guys. I appreciate y'all hanging out. Smart strength. I mentioned about the smart strength. There's that. And then Relief Academy. 8 people still watching. I appreciate you guys for hanging out. Relief Academy. Fitnessforbackpain.com/relief academy. I always gotta check my spelling. I'm a terrible speller. Okay, so there you go. The first one is for Nick and anyone else up there who I was talking to. Jermeet, Smart Strength membership, and then there is Relief Academy that I'm referring to. You can get more information by checking those out. Touching your toes doesn't sound like a good idea. Definitely just covered that. Appreciate that, Julian. You are right. Connie, hopefully that helped you. Hopefully that kind of gave you some insight on what you should do going forward. For me, touching my toes is like decompression therapy. My bulge is anterior, so it relieves the pressure. Anterior as in it's bulging to the front, like towards your stomach? Or do you mean are you calling that anterior? If you're still watching, let me know. Let me know. So yeah, the decompression works, and I hate inversion tables, and I probably have one of the most hated videos. I need to redo it, but it's probably one of the most hated videos on the internet for inversion tables. Just type in inversion table, teeter table, whatever you want to call it, and my mug will pop up, and that old video from like 3 years ago will pop up, and it's probably the most hated video on the internet for inversion tables. But I'm not a fan. I'm not a fan of them. They're dangerous. The what you experience on them leads to doing worse things on the inversion table, because it did for me. Watch that video. But there are some great decompression ways there's better ways to go about decompressing the spine. There you go, got it out. So there's lots of ways. You can use a countertop, you can use resistance bands, you can use the edge of a bed. Like there's lots of different ways to get that short relief. But again, even if you do decompress is good. There's a lot of theories of like nutrients getting into the disc and taking away inflammation. There's lots more productive things you can do than just stretching that lower back or that area. It's a good tool if it helps you navigate towards getting out of pain forever. That's awesome. Keep doing it. But if you have to continue to keep doing it, let's look at some other things, right? Good stream. Appreciate you, Nick. It's gone long. This is 40 minutes now. Maria, thank you for the tip. I'll search it later. My scoliosis was pretty bad and I was in pain. It has been reduced with surgery and I feel better, but still a long way to go. Keep it up. That's a victory. Always look for small victories, because that is how you're going to get out. I promise you. If you don't focus on like, okay, my main goal is to run a marathon. Well, there's so many awesome things that are going to happen between now and that marathon, right? Don't just focus on the marathon. Focus on what happens tomorrow. Focus on what happens a week from now. The victory that you have, the exercise that you couldn't do, that you tried to do, and then nothing triggered, nothing spasmed or tightened up or tensed up. That's a freaking victory. And you got to celebrate that stuff, because if you don't, you're always going to be missing because you're not running that marathon. Just like weight loss, just like anything, the daily stuff is just as important as the big stuff. And when it comes to your nervous system, pain, fear, anxiety, and understanding your brain's um, its responsibility in pain, once you get that and you celebrate those victories, it will desensitize. I promise you. Connie, I'm getting stronger every day. Awesome. I enjoy your short YouTube workouts. Awesome. Um, Sweet. Awesome. That's it. Well, I'm done. 40 minutes. I'm done. I appreciate y'all for showing up. Appreciate you guys for chatting. If there's more topics that you want to talk about, if you're not in my Facebook group, jump into my Facebook group. If you are not on my newsletter, I put out weekly content every single week, twice a week, if not more. Get involved with that. Shoot me an email. Let me know what you want to talk about. Find me on Instagram, whatever. Just shoot me an email. Let me know, hey, I can't find information on this specific situation. If I know about it, if I've had experience with it, I'll talk about it. All right. So I appreciate you guys for showing up. Thanks for engaging, talking. Love hanging out with you guys. And I will catch you later.